Just wanted to take a moment and welcome everyone to today's panel discussion focused on Scale Up, Creating an Enabling Environment. My name is Vicki Hausman. I'm a partner with Dahlberg Global Development Advisors, and I'll be moderating today's discussion. We have 4 exciting panelists with us. 3 exciting panelists, one who unfortunately sends his regrets. Unfortunately, Eddie Makuyo couldn't join us today. But we have Hayo von Bema from Text to Change, Sarah Emerson from the CDC Foundation and the mHealth Country Partnership, and last but not least, Garrett Mell from WHO. Before we begin, I wanted to just briefly share a few reflections and set some context and frame for today's speakers, and then the time that we'll have at the end for some open Q&A. Thinking back on previous mHealth summits, and I look around the room and see many familiar faces, and know a great number of us have been to several of these in past years. And the topic of scale is not a new one. It's one that's been talked about for several years now, and looking back over the past 5 years or so, the majority of mHealth deployments have been pilots, and there's been an ongoing dialogue about the need for scale. But few actually make it to either national or regional scale. There's been a lot of positive momentum, so on the books at least, there are more and more countries and national governments that are setting e-health strategies, but there's some variability in terms of how established those are and how robust those are. And similarly, there have been individual deployments and the efforts of our panelists today in moving from pilot towards a growing user base and starting to move into greater scale. There are a range of challenges in the enabling environment, many of which I'm sure we'll hear about today, be it policy, financing, capacity, or design, all of which create challenges in terms of scale. And one statistic I just wanted to share briefly, when we looked in a study last year that Dahlberg conducted at financing for mHealth, historically 85% of funding was going to early stage R&D or pilots, with very little funding available to move beyond the pilot stage into more of a growth phase and towards maturity and scale. If you contrast that even conceptually with something like you'd see in more traditional entrepreneurial spaces like a Silicon Valley, the startup capital is actually much smaller scale than the growth capital and the capital for scale that lies beyond pilots. So clearly a lot of work to be done, and this is just one illustration of enabling environment constraints. I'm sure we'll hear about many more constraints and opportunities from our panelists today. So with that context, and without further ado, I'm going to introduce our first panelist, Hayo, who will talk to us about his work underway. Hayo?
Hi, thanks for having me here. Challenges, well, they're great to talk about, but I mean, today is also about the great opportunities that the mHealth has. Been around in the space for a couple of years now. We're celebrating our 5th year of implementing mHealth campaigns in Africa this February. So yeah, been around for a couple of years now, and we've seen a lot change. mHealth in itself, I mean, I can remember the first mHealth summit here in DC in 2009, where it was all about pilots, and we called it pilotitis at that point. It was the biggest disease in mHealth. And what we've seen scale throughout the years, I mean, especially in the number of conferences and the number of people attending conferences. I mean, if you go downstairs now in the exhibition hall, I mean, I'm afraid of even going in. It's the Disney World of mHealth at this point. And it's awesome. I mean, it's amazing that the mHealth space has picked up this much speed. But it's also giving us some thoughts about where we went, where we came from, and where this field is ending. From my perspective, working for a fairly small NGO based out of the Netherlands and Uganda called Text to Change, our biggest scale has been on an organizational level. I will be honest with you. We have implemented something of over 60 small, semi-large, and some larger mHealth campaigns. But I mean, for me, the focus has always been on the organizational level. How do you scale an organization implementing mHealth campaigns? But I will take you through some of our campaigns as well, the challenges, and I think, well, I won't exactly give you the ingredients on how to scale, but let's see if we can get there one pace at a time. Emerging markets, it's the only thing I know. I mean, we're here in the sea, of course, and there's a lot going on here in the domestic markets, and in Europe a bit as well, but my expertise really lies in how to implement, design and execute good mHealth campaigns in Africa. We have some work in South America, but as we've seen in the statistics, the majority of the programs are still running in Africa. Oh, let me go back a bit. This is like just the basic Google Trends. It's skipping. So what is happening with mHealth? This is just if you type in mHealth in Google on what the trend has been.
The Health Information and Management Systems Society, or HIMSS, a co-sponsor of this summit. The U.S. currently dominates the mobile health technologies market, holding approximately 51% of that market share in 2011. The large majority of mHealth market share is attributed to both software and services, which accounts for 80% of the total market. The other two sectors, hardware and network connectivity, respectively account for 12 and 8%. The U.S. is also the main market for mHealth solutions and contributed $660 million to the global market in 2011 alone. Europe and Asia Pacific region contributed 420 and 120 million respectively. However, there are also obstacles to this market as well as opportunities. Competition is growing among both developed and mid-level developing countries that see and want to capitalize upon the growth opportunities of the sector. The issues of interoperability and new and adapting regulatory and standards regimes, network capacity, technology education, and other factors will also play a role in how fast and how widely these new technologies are made available across markets. So now, to look at how our panelists are successfully tackling these and other challenges, let's now turn to our first speaker. Ladies and gentlemen, let me introduce Mr. Chuck Parker of Continua. Chuck?
Thank you. Okay, thank you very much. Appreciate that. So, yes, thanks for setting the groundwork here for what we want to talk and cover a little bit more about some of these activities. So, just a quick brief activity around a background on what Continua is. We are a not-for-profit alliance. It's been around for about 6.5 years. And we are focused on the interoperability standards, on getting these standards in place for devices that typically occur outside the four walls of the traditional healthcare space. So these would be things such as blood pressure cuffs, weight scales, glucometers, spirometry, pulse oximeters, things that an individual could use effectively at home, but at the same time being able to keep them out of the facility and be able to allow them to stay in their environments more effectively. So what is personal connected health? It's truly the individual and focusing on the individual's care and needs at that point of wherever they happen to live. It's not necessarily bringing them into the facility. It's where are they living, where are they working, where are they playing, and being able to provide them that care and that activity at that moment in time and be able to measure them effectively. So it truly allows us to take these devices, measure and collect and create an overall ecosystem for these devices to help the individual effectively monitor themselves or provide information to the extended caregiver network that may be caring for that individual as well. So there are typically things that you see as chronic disease management. So it's really managing somebody who may have a disease which they're never going to recover from, but by given the right tools can actually help manage them and have a high quality of life. It's also aging independently. It's the category of individuals who are growing older, but with simple reinforcement tools can maintain their lifestyle and maintain their home lifestyle for much longer. And ultimately what we want to do is in the third area of this is a health and wellness activity. That is, how do we keep individuals healthy and well? How do we keep them from ever getting into these disease states and getting to the point where they have critical conditions or having to go into emergency rooms? So what we want to do is provide them those tools to help them manage their lifestyles more effectively. So just quite, a little bit of a background here. We're seeing that this is an area where we simply are seeing an explosion of this, not only in the U.S., but this is also a global epidemic, where we're seeing chronic disease states continue to increase, hypertension being one that leads to many things downstream as well in this case. So hypertension leads to, for example, blindness, strokes, kidney failure, and other heart disease ailments in this case. But we also see diabetes here, as well as some of the other cancers that are growing in our populations. And by simply providing the tool sets for these individuals, we can provide them with the ability to manage their lifestyle more effectively. So we see that, for example, with heart disease, 83% of that is actually self-modifiable. If we simply had the tools and knowledge to know what we needed to do, we can actually control significant portions of these disease states. Here again, something that's global in approach here. So here's some of the benefits of what we see is in this particular area about personal connected health. Allows you to remain at home, have the awareness and understanding of what's going on more effectively in this case, and it avoids those costly ER visits. And in a lot of cases here, it provides a better discourse with our provider community and network. But I think that overall what we want to do is talk a little bit more about some of the trade aspects of this and how does this actually apply. Because this is a global problem. This is not something that's a U.S.-based only problem. It's not something that is a European problem. Even in developing regions, we see this as a new opportunity because in some cases, for example, they're generationally skipping the landline phone. They're going direct to the cell phone. Well, that allows us now a tool to be able to enable the technology that can actually capture this data. We can now effectively provide them in these communities, in for example, sub-Saharan Africa, tools to manage child and maternal health very effectively, simply by providing a weight scale, a glucometer, and a blood pressure cuff. We now can provide tools that they've never had in healthcare capabilities to individuals who may be healthcare workers, not necessarily the providers in this case, but healthcare workers who can help these individuals now. So now we can export this by providing a standards-based approach. We can now use these tools and reuse them more effectively as well. So while I may use a blood pressure cuff today for that individual who has, we're monitoring on that maternal program, I can turn around and use it for that hypertensive patient as well in the same community perhaps later down the road. So that's one of the things I think we're looking at here on a global standardization basis. It allows reuse of these tools. That helps lower the costs overall for us. Because once you achieve those levels of standardization, you reach an economy of scale in that sense. And you reach scale in two different ways. It's economy of scale because now you can deploy these products more effectively. But you also can reach scale because now no single company is going to be able to provide the level of healthcare devices that we need in the world today, much less in the United States. So you're going to need multiple device manufacturers across the globe and even across regions and across countries specifically. So you need to have an effective way to be able to link those and be able to provide them a standards way to approach how they connect to the overall system in and of itself. That provides you that back-end system to connect and provide you those alerts across the board as well in this case. So one of the things here is that there is a key interoperability as the driver for this adoption in mHealth. It enables convenient, robust data exchange overall. We can reach the large scale. We have ease of use that promotes positive user experiences as well. So when you get to the plug-and-play capabilities, it allows you to plug and play those devices so the consumer can put these together. It doesn't require expensive medical care in this capability as well. One of the things, though, I do want to kind of cover here that's not necessarily on the slide, and that is really some of the things that we do offer within Continua, and that is the capabilities of what an alliance like ourselves can provide to the industry. So not only do we bring together companies to help set global standards, and I do mean global in a positive way in that sense that we now can provide a mechanism for organizations to standardize the approach and not have and create country-specific solutions. So I think that's one of the things that we've always seen as a major issue in the healthcare arena is that we have, in the acute care setting, we have very specific country-by-country specific needs. What we're looking at in the personal connected health space, and that is those that affect the ambulatory care setting, the long-term care setting, and more importantly, the home setting, is a standards-based approach that allows us to expand beyond that and allows us to create a global set of standards that can be implemented anywhere. Why is that important? Because it allows us to export more effectively. It allows us to be able to carry those technologies anywhere in the globe at that point. So we can now move those technologies across borders. We can move them into anywhere. And with the economies of scale, you have lower cost products available in the market space in this case as well. So, but another component of that is that the Alliance does provide some sort of background activity, and that is in the matchmaking capability. So when we bring these member companies together, it's 200 member companies representing the industry, it becomes an effective way to provide companies or countries in some cases an effective way to reach out to a large group of organizations very quickly. So in essence, they can provide a request to continue it, for example, and reach 200 companies relatively fast and easily in that sense. Similar to that as well is that we also provide a level of matchmaking capabilities when we look at how do we connect these organizations together in the sense that, you know, it's a business-to-business type of activity. So you may have an organization saying, I need to find a solution for X, and then within the community be able to find those and be able to link with those types of activities and those companies and those that are providing solutions in that area. So I think it's very strong to take a look at, you know, when we look at how do we approach this market space. Continua is there to help set standards, but in and of itself, it's much more than just a standards-based body. We certify the devices to ensure that they've met that interoperability, but we also provide opportunities for organizations to reach out from within their boundaries out into the larger community across the region itself and reaching for those capabilities. So here again, just to let you know, we are a not-for-profit organization and industry alliance that's focused in these approaches today. And we publish guidelines that combine and apply these existing standards and then create a certification model around that. So with that said, I'll turn it over to our next speaker and say thank you very much, and we'll be welcoming some questions a little bit later.
How do I get the slides to come up?
We'll take care of it.
Oh, okay, got it. Great.
This is Erica Kochi of UNICEF.
Yeah. Hi, everyone. So I can basically probably get started before the slides even come up. UNICEF and mHealth. What do we do? UNICEF, I'm not sure how familiar you are with us, but we are a UN organization, and we work in 160 countries. The vast majority of our staff is on the ground in countries. And unlike some other sort of smaller NGOs, our main partner is government. We work directly with government and we provide support to them in the areas of health, education, water and sanitation, and child protection. I'm going to focus to sort of my talk today specifically on our engagement with mHealth. And sort of these are the four areas that we support with mHealth. Scaling up nutrition, there's a very large initiative called the SUN Initiative, Scaling Up Nutrition, that we try to support. Community case management, that means basically community health workers who are trained professionals but sometimes volunteer, that they're allowed to actually treat and diagnose for the most common childhood illnesses, which is pneumonia, diarrhea, and malaria. Prevention of mother-to-child transmission of HIV/AIDS, trying to ensure that no kids are actually born HIV positive, so the mothers don't pass the virus on to their child, and reducing maternal and neonatal deaths. So these are sort of the four areas that we work in. And essentially our mHealth strategy sort of supports one very, very large initiative called A Promise Renewed, which is something that over 80 governments have signed on to. It's a partnership with USAID for one instance, and many, many other partners in global health. And what we called MORIS, which is essentially real-time monitoring. So we're looking at how do we support these four areas, and this all sort of dovetails into what we call A Promise Renewed. So what does this actually mean? Essentially, we have something called the 1,000 days. 1,000 days is from the point of conception up to 2 years of age. And we work on two levels in the area of mHealth. One is ensuring that community health workers have the right tools that recognize their work, link them better with the formal health system, and help them deliver a better quality of care. And then also ensuring supply. So using the information that national E and mHealth systems generate to enable all levels of the health system to better manage programs in real time. What this actually means is something actually very, very simple. We're talking about very, very basic phones, low bandwidth situations, so no electricity perhaps, and where many people may not even be able to read and write. So essentially what we're trying to do are these things, creating a unique ID, and recording age, weight, and last birth, and as you can read, etc. And essentially what we found is that you look at these things, and these will prevent, if you can ensure that women, the pregnant women and children have all of these interventions, you can really work towards preventing about 80% of all child and maternal deaths. So an example of this is, I'll walk you through this one. This is a program we have going in Rwanda, and you can see it's really focused on the antenatal period, so when a woman is pregnant. And what we do is we help community health workers register pregnant women and give them a unique identifier. And we have a system, which is an SMS-based system, that helps track them through their pregnancy, ensuring that they receive basic antenatal care, but also recording danger signs. And if there are too many danger signs, we'll try to get them to go follow up and ensure that the mother delivers at a facility, so she is at much less risk of dying during sort of the later stage of pregnancy or delivery. And we've seen tremendous success with this. We're now going to be adding nutrition and other postnatal services onto it. But all of this is in partnership with the government and also with some other groups. For example, we work with the private sector, we work with academia, and we work with the big partnerships. So Promise Renewed is one of the big partnerships. An example of how we work with the private sector is we bring in their expertise to some of these challenges. UNICEF is not a technology organization, and we work with a lot of design groups and a lot of software development groups to actually bring their expertise directly to some of the challenges in global health. For example, we have a partnership with Frog Design. And the way we've created this partnership is that we try to align their core, basically our partnership with their core business strategy. So it's not something that's just done on the side as, you know, a little bit of corporate social responsibility, but something that actually makes sense to their bottom line. For Frog, a lot of their new customers are mobile service providers. So this helps them show their customers that, and their clients, that they are forward-looking in this field, and they're really working on the edges of this space. Another one of their big client sectors is obviously the healthcare industry, including, for example, General Electric, which works in this space. General Electric is also a partner of UNICEF, so we're bringing together Frog, General Electric, and the government of Rwanda to expand this particular program. We also work with academia. We have a bunch of classes with, for example, NYU or the Art Center out in Pasadena. But we also work with pairing them with universities in developing countries. For example, we work with Makerere in Uganda and with IIT in Delhi in India. So when you think about what this means for exporting, all of the work that we do is in the public domain. All of our software is open source, and everything we produce is publicly and freely available. We've seen that this really enables one country to be able to take what they've done and export it very quickly to another country. And another country can pick it up, customize it for their own local situation, and hopefully, you know, add more to it. So we work very much in that vein. I just wanted to show you a little bit about one specific partnership that we're involved in called Empowering Frontline Health Workers with all of these groups. And essentially the real goal of Empowering Frontline Health Workers is to strengthen the capacity and performance of frontline health workers so that they can deliver high-quality maternal and child health interventions in low-resource settings. And as you can see from this group, we're all, you know, very, very different types of partners, but we all have sort of strengths in certain areas. So happy to take questions afterwards about this. Thank you.
Our Our next speaker is Alice Borelli, and Alice will tell you a little bit more about some of the projects that they're working on as part of the partnerships. And at the end, there's also some materials in the front that will help with some of the materials that they're talking about. They'll have some explanations about programs. I'll tell you about that later.
Well, thank you, Nancy. And first, let me thank Nancy and Fred and Mac, all from the Department of Commerce today, for really role modeling what a partnership should be. I was just in China last week where the Department of Commerce, Ministry of Health, and the World Bank brought together the heads of all of the health IT programs for the provinces in China as well as in Beijing. And then they asked 3 American companies to come in and talk about healthcare reform and what was going on in the U.S. And it just made for a really good conversation. We we may have very different types of governments, but we have the same healthcare problems. And so having that kind of exchange and having the Department of Commerce really help enable that discussion was extremely valuable. So thanks a lot for doing that. And Intel operates in 80 different countries. We are an American company. We build most of the products. 75% of our products are built here in the United States. But the 75% of our products are then sold abroad. So we have factories internationally, even though most of the product is made here. So when we go into a new economy, to work with the economy in terms of either research and development, manufacturing, sales programs, it's really essential to have a good relationship with that government, with the Ministries of Health, with the Department of Education, because you just don't get very far if you don't really invest and put time into those relationships. And the appreciation for that involvement was really demonstrated last week when Intel received the ACE Award, the Achievement for Corporate Engagement, from Secretary Clinton as one of the 2 companies from the U.S. to really demonstrate that involvement, that CSR involvement, and really close relationship with the country. So we're very proud to receive that. I had nothing to do with it, but I got to attend the reception, so that was great. But it just really focused, and the ambassador nominates the country, or the company, and we were nominated by 4 different countries and did win the award from Vietnam. And the reason we won is because when we manufacture there now, and we found that we really needed higher skilled engineers. So we selected 80 different students to go to Arizona State University to gain those skills and come back and be great employees of Intel. And 80% of those selected were women, which I think is a real sea change for that economy. So anyway, those are just wanted to start off with that so we can get the ball rolling. But Intel has been leading healthcare initiatives from a partnership basis for many years. And whether it's education, educating the workforce, whether it's providing rural doctors and clinics with accessibility and connections back to a headquarters function, virtual care beyond the hospitals, and of course going out and becoming the direct link, the front line for healthcare, frontline healthcare workers. We have had projects in many different countries, and I'm going to talk about a few of those. But first let me start with really defining what is mobile health. Now, the mHealth Alliance, and of course they're one of the sponsors today, gives the definition of mHealth stands for mobile-based or mobile-enhanced solutions that deliver health. Well, I think we all have our own vision of what mobile health is, but I thought I would take a few minutes to talk about different devices and really how they factor into mobile health care delivery. So if we start with the first, which is just a feature phone, and Erica, I think you mentioned that's one of the devices you use in some of your programs. We started a few years ago with a program in Bangladesh where we did use a feature phone for healthcare workers to to gather and send information back to the doctors who are located in the local clinics. All of that data was then attributed through EHRs to different patients, and then the doctors could message back to keep in touch with those mothers, the mothers-to-be who were at risk. So that's sort of the first level. Then the example of the smartphone today, what I'm hearing is one of the values of having the smartphone is having the clinical decision support tools loaded right onto the phone. So as a doctor is practicing medicine, the alerts, the information is coming back to him or her immediately in terms of the kinds of information they need to make clear diagnosis and treatment, as well as to forward any information that they need in a very secure, HIPAA-compliant way to a consulting physician. So it's real point-of-care access. Another example is the tablet. Intel has an MCA tablet. We developed a form factor about, I think, 4 or 5 years ago. And when the earthquake happened in Haiti, the Israeli Defense Fund bought these tablets to send into Haiti to really be able to gather information on the patients through electronic health records and, in fact, provide connections for the kinds of care that these patients needed. So we're going up the value chain now, and then we get to the Ultrabook, the PC that we've come to know, which is now, of course, very mobile, lightweight, and we see this being used by, of course, physicians, but also by nurses. And the nurses need, of course, more information at their fingertips to be able to go, whether they're visiting nurses or bedside nurses. And the lightweight devices are really providing that information. And if you go the next level, so that you have a tablet kind of PC device, Ultrabook, which is mobile, then you can start having collaborative care discussions with 2 different consulting doctors. At the same time, they're looking at real-time biometric information as well as radiology reports. So that's when you get to a very high level of mobile device, and the kind of device you need to choose needs to actually be consistent with that kind of information. So we are definitely seeing, a transformation of the healthcare industry based upon these devices, but of course it has to be the right device for the right time. So now I wanted to just sort of change gears and talk about education, educating the frontline healthcare worker. And this is an opportunity that Intel really decided to zero in on, because we have such a wealth of information from a program we've done for the last dozen years called Intel Teach. We've taught 10 million teachers on how to use basic PC skills in their classrooms, and most of that teaching has been done outside of the U.S., primarily in emerging economies. So with this data that we have and the ability to figure out what is needed in a robust education program where you can take assessments and you know what new skills are needed, and it doesn't have to be connected all the time. You can have intermittent connectivity as you're taking tests and training and reporting that back to the headquarters authorities. We thought we could be very effective and helpful in this area. And that's why we're part of the Empowering Frontline Healthcare Workers that Erica mentioned earlier. We have MOUs with a number of different groups, including USAID, UNFPA, JPAGO, and other nonprofits as well as governments. And we are quickly mobilizing this tool to go into the emerging economies. Fortunately, I have the person who actually developed the tool sitting in our audience, who is Matthew Taylor. So if we get into any technical issues, Matthew can handle them much better than I can. But we recognize the shortage of healthcare workers. We know they have to be trained, and training them remotely in their location of care seemed to be a real need that wasn't being met. So Matthew developed this platform that is both a PC device. It doesn't necessarily have to be a PC, but it does have to be a device. And we run a license, an open licensure agreement we have for the kind of platform that's needed to have this educational material. So it is free. It is available to governments. We're always looking for new and better content that is specific to the country to add into it. It's never static. And then, of course, the countries can use the cloud, the data center, to actually store additional information in much more robust content in addition to the kinds of assessments that they need to run for this intermittent connectivity. So it is a program that we are really thrilled to be partnering with. We think we're going to see amazing results. And our goal is to train 1 million healthcare workers by 2015. This gives you a little bit more. I think you can see some of the partners that we have, both local as well as international partners. And this will show you a little bit more about the platform capabilities and what the educational materials look like for the frontline healthcare worker. So the first country that launched this program was Sri Lanka. And Sri Lanka has committed to train 100,000 healthcare workers. That's their number one goal. And the number two goal is to adopt electronic health care records for school-age children in 5,000 schools. And what a novel idea. I mean, here's a country that sees the value of EHRs, and it's one of the few that I think has really used the school setting to develop that kind of information. One last program that I want to talk about before we get into a larger program is the one that we did in Nigeria. And this was to mobilize healthcare workers to go to the front lines. So it not only involved Intel and our partners in software and medical devices, but we also had to partner with Jeeps to get these frontline healthcare workers into the points of care that they needed to actually be helping folks. So sometimes my point is you just need sort of a different kind of partnership that you wouldn't really be expecting to actually follow through on the value proposition. And let me tell you just 2 points on the value proposition. We increased access by 270% in this pilot program, and we increased data collection on diseases in the community by 900% by having these tools, the netbook, the Jeeps, the frontline healthcare workers to do the data collection. And just once again, you know, the PPP model is really necessary for sustainability. And, you know, one of the problems that we all have experienced is the fact that we have one-off programs. We don't have a lot of connectivity among the kinds of really great programs that are going on in emerging markets as well as developing markets. And that's one of the reasons that drove us to try to do the Frontline Healthcare Worker program, because we knew that we could combine a lot of resources into one program and it would be sustainable. And that, you know, without this path towards what are you going to do if it works, you really haven't created a program that can be successful and scaled out. So 2 points that we think are really important for success. So next, I wanted to talk about a program we're doing in China as an example of a private-public partnership. And this is one dealing with aging. And just as in the U.S., aging is becoming a huge social and economic issue, particularly with regards to the one-child family, as well as so many of the working age folks going to actually live in the cities and leaving their parents at home without any attendance. So the Chinese, and this thing is going crazy without, I'm not even touching buttons, but it's okay, we'll get through it more quickly. You're not, okay, we're fine. So let me just talk through it. We've worked with the Ministry of Civil Affairs to really create a blueprint of what a Chinese culture would look like if there were a goal to keep 90% of the Chinese seniors at home, in their homes, seeking health care there rather than institutions. And what if 7% of the Chinese population over 65 would be working with different community organizations, and the final 3%, only 3%, would be institutionalized? That's the part of the 5-year plan that the Chinese have. So they came to Intel to say, how are we going to do that? How are we going to make this happen? What kind of services do we need? What kind of technology platform do we need? And so this is a very initial beginning that we have with the Ministry of Civil Affairs to build out that platform that would provide not only health care in terms of remote patient monitoring and telehealth, but also the other needs of a senior, the social needs, social connectedness, transportation, Meals on Wheels, and building a platform so that it's very easily enabled for the senior. So this is a program, as I said, we've just started in the age-friendly city category, and of course we have some really famous age-city-friendly initiatives going here in the U.S., in New York and City and Portland. But we're really excited to be part of this one because there's so much emphasis on keeping seniors viable, active, and living independently at home. So we're looking for new partners. If you're interested, let me know. We have a lot of in-country partners as well as working with the Ministry of Health. And then finally, I wanted to just talk about, what do you look for in a public-private partnership? What's going to make it work? And I think we as funders really need to start stepping up to the plate and saying, if we're not going to have coordinated standards, if we're not going to have programs that are going to cooperate with other programs in the country, then why do them? I mean, we really have to drive this point home, that you have to have interoperability of programs as well as technologies, and figure that out before you even get started. When you start the program, are you going to be able to connect the field workers, the clinics, the hospitals, and patients? Because if it's a standalone program in one small province, that is really not the objective of what mHealth, the vision of mHealth that we see at Intel. We see it being very robust and connecting all sectors of the healthcare community. What are the plans for sharing your success and your failures? How will the MOH incorporate the success into national programming? And finally, what is the stakeholder involvement and what do they get out of participating in these programs? Because as we know, if you're not going to be benefiting, it's very hard to get participation in the next round when you start looking for partners. So finally, I just want to say we need to really stand together, all of you funders out there, as well as partners in other ways, and hold hands and say, it's got to meet the standards, we've got to have interoperability and a way forward before we start funding a new program. Thank you.
Thank you, Alice. Also, one of the materials that we have on the table is the Standards Alliance program that USAID sponsors, where they help to provide standard support for countries that are working for interoperability and to develop their standards that will help create more partnerships. And last but not least, we have Mac Tadeo from the Trade Advocacy Center at the Department of Commerce.
Good afternoon. Thank you to the organizers. It's great to be here and to share what we have to offer. I'm part of a team at the Department of Commerce who pulls together what services our clients need. That's all of you in the audience, all those who are U.S. companies looking to export their goods and services abroad. As Alice was so kind to mention, as far as some of the services, we do trade missions, we do trade exhibitions abroad. We rely on those markets where we see U.S. companies having an advantage to set the scene for you, to provide the types of services like matchmaking services when you're looking for an agent or distributor, market research that you need more information on the local market. Is this going to be attractive for my product or service? We're located in 70 countries, specifically with U.S. commercial service employees. I was a commercial service officer, served in Latin America for 14 years, and we were on the ground there for you. Though we're in 70 countries, that represents actually the markets, about 96% of all commercial trade. So we're there where you need to be also. Where we don't have an office, the Department of State, through the U.S. mission, the embassy, has someone on the ground who can help you too. But we concentrate on those principal areas where you can do business. So our mission, including getting you together and matchmaking, it's about leveling the playing field. We do that specifically for those areas in which you're looking to export abroad and sell to the government. So this is all business to government. My colleagues on the ground will also help you matchmake business to business, find the partners you need so you can be successful. We'll have people here on the ground in the main Department of Commerce, as well as our domestic offices across the United States. They're called U.S. Export Assistance Centers, to pull together the type of financing you need, market research I had mentioned, but also some of the partnerships. It's a complex market out there. And so you'll need the U.S. government, you'll need partners to pull together consortium groups, particularly when you're looking to sell to a foreign government. And it involves lots of competition. When I started in this business about 25 years ago, U.S. manufacturers and service providers dominated much of the industries and markets out there. That's no longer the case. We have very strong competitors, and we see our counterparts on the government side doing the same thing we're doing, helping their own companies try to get a leg up on the competition. There was an article in this morning's Washington Post with Secretary Clinton, a great advocate for U.S. business. She was in Prague, and she was looking to help Westinghouse specifically try to get a major government tender for civilian nuclear plants. This is over the next 15 years, can be anywhere from $9 to $15 billion, of which probably a third of that will be direct U.S. exports. So it's of interest to the U.S. government. The administration talks about creating jobs and sustaining jobs here in the United States. So we're that person that on the ground who can help you do that. We're also in the multilateral development banks. We have EXIM, OPIC, but we also participate quite heavily with the multilateral development banks. That's the World Bank here in town, as well as the Inter-American Development Bank in London. There's the Economic Bank for Reconstruction and Development. There's the Asian Development Bank and the African Development Bank. The African is in Tunis, the Asian in Manila. These are resources also available to help you finance or help those who are going to be procuring your products and services help you sell abroad. As I said, we work government to government. We're a counterweight to that other foreign government pressure that exists through other embassies, through other senior government officials that go abroad and advocate on behalf of their own companies. We're looking for fairness and transparency. You're oftentimes the ones who are looking to compete and sell abroad, and you are the ones who usually come to us and say, there is something in the foreign government tender that's about to come out that is actually excluding or working against U.S. companies. It's looking for other standards that we cannot compete. It's looking at extremely low prices where we know it's for one particular service provider that's getting below market financing through their own governments. We raise those issues to the government that's looking to procure. It's about leveling the playing field for you and making it fair. We're deal and project focused. So you come to us and say, we're looking at a specific industry and a specific market for a specific tender that will be coming out. We can work with you anywhere along that continuum. We have companies who come to us and say, we want to get in early. We know that this government has been talking about and interested in expanding in this product and service. Healthcare is a perfect example, where much of the healthcare procurement in many countries is through the central government or through the state or provincial level. So you have government decision makers. They have interests of their own to try to set up, and we'll get in early on the ground, sometimes with the USAID, with other international organizations, talking about here are standards, here's policy, here's systems that you might want to put in place to improve and expand the quality care for your citizens. So we'll help up front. We'll introduce you to these government officials to help design and set up the programs where you can have future sales. What we are not, and what we don't do trade advocacy, we have U.S. trade representative. I have colleagues inside of the Department of Commerce where we already have bilateral deals. Free trade agreements, CAFTA, NAFTA, that we have with numerous countries across the globe. They oftentimes set the scene in the context and tell governments how they're going to be doing things. We've agreed to do it a certain way. I have those colleagues who come in as part of the partnership with you, say they're not following the FTA. They need to do it this way. WTO disputes, that's something that's done at a different level with other folks. If something is reached the courts and their own national court system is handling it, we let the court system handle it. So how do we do it? We work on the ground, in the missions. We set up a deal team. You come to us, you say, here's an issue we'd like you to raise. We build a partnership with you, our folks on the ground, and ourselves at the Advocacy Center to see what kind of strategy do we need to put together. It's very customized and hands-on specific. We'll be talking to the people who are the decision makers, anywhere from my counterpart as a commercial officer or economic officer. The ambassador will talk at his level. We'll raise the level through many foreign visitors, official visitors that come to the United States, get to know how we regulate and do business here. They're called orientation trips. Both the State Department as well as USAID and also the U.S. Trade Development Agency bring foreign officials here to learn how we do it. We'll also invite U.S. companies to show their facilities, their manufacturing, their offices, how they service their products here in the United States, and how we're looking for them to excel abroad. We do have a process. We are the U.S. government, so there's a process to follow. We try to make it as easy as possible. What we need for you to do is to alert us what specific issue is at hand. There's an advocacy questionnaire that you have to fill out. I'll get into more detail on that. There's an anti-bribery agreement. Obviously, as far as doing business abroad, we have standards that we want our companies to follow. There's the Foreign Corrupt Practices Act that forces you to say that you will not bribe officials, that you will follow general U.S. as well as international guidelines and standards for doing business. We had to come up with a national interest determination. Is this in our interest to work with you and on your behalf? In the healthcare industry, I have yet to come across a case that we would not back a U.S. company looking to do business. That oftentimes occurs in defense or intelligence related areas. I don't have to get into the politics of how complex that can get. crafting the appropriate strategy. I talked about customizing. Who are the people you need to talk to? Who do we need to get in front of so that we can make the most difference? And coordinating that message so everybody's on the same page. Advocacy questionnaire. What project are you looking to compete in? What is the total value of the product? What is your participation in the product? What U.S. export content will there be in products and services? Are you partnering with other folks? We'd like to know who you are partnering with and the consortium groups so that we can strengthen that advocacy for you. You might already have a few ideas of what needs to happen. There's this decision that's coming up in the next 6 months. We need to get ahead of it and make sure that before there's an official design and publication of the tender, that it does not include these clauses that will exclude you as a company or U.S. as an industry. What are the expected dates? It's very time sensitive. We want to use the chits we have to do the advocacy as effectively as possible. Try to work with the specific decision makers as well as the timing of when these decisions are to be made. We also like to know who your foreign competitors are, as well as U.S. competitors. We have cases we call generic advocacy. There are 2, 3, sometimes even 4 companies competing, U.S. companies, against each other in a foreign market. That's fine. We will advocate on behalf of all those companies. Sometimes there's a down select. 1 or 2 companies are winning if there's only, a part of the selection process for final proposals. If there's only 1 U.S. company left, we'll work on your behalf exclusively. If there's more than 1 company, U.S., we'll work on behalf of those few that are left. I mentioned the national interest determination. Again, we are about supporting and sustaining jobs here in the United States. We do understand that in a global economy, there is some sourcing you have to do from abroad, but we want to know what those parameters are. What are the percentages? Or what crucial U.S. export that might be needed for a successful win. In that, we take a look at the type of technology. And it may be very low initial U.S. export content, but it'd be the first time that a U.S. is breaking into that market. We'll work with you and support you to try to get into that market, knowing that if you're successful, that there'll be other projects ahead, other procurements, that we can expand the type of U.S. companies that can participate in that industry. We're divided into regions, and we cover the entire world, so that where there is no commercial service office, we partner with the State Department. We set up, again, the deal teams across the globe. Where we see tremendous growth, significant growth in double digits around the world, are in Southeast Asia, certainly China, India, Sub-Saharan Africa, where governments are now have the monies available to invest in their health care, in their infrastructural development, education, defense, road and engineering projects. The Western Hemisphere has been active for quite some time. The Middle East is one that's fast growing. The Arab Spring has created new markets lately in which U.S. companies are going in. It's those emerging markets where we can actually do the most for you. Players change, decision makers are people that you need to get to know well, to know that the type of business you want to do is the type of business you want to be represented in. We have the type of capability to find out who the decision makers are, what their backgrounds are, will it serve you long term to do business. So here's the specific contact information. You can give us a call at that general number, 428-3896. You can also go to our website, www.export.gov/advocacy. And lastly, we left just open for business. It's a one-page, two-sided brochure where it shows you where we have offices in the United States. We're in about 100 cities. as well as the international offices abroad. So we hope that you can join us and we can help you expand your business. Thank you.
Thank you, Max. And all of those services are free of charge, part of your tax dollars working for you. And with that, if there are some questions, we'd like to take those now, and you can pose them to any and all of our speakers. Just ask that you come to the mic and identify yourself and then address your question. Thank you.
Thank you for all of your great presentations. This was a really interesting discussion. I think my question, sorry, I'm Heather Vidot from FHI 360, and we've been doing some mHealth work in East and West Africa. But my question is for Erica and possibly Alice. Erica, with your program, it sounds like we're at the stage of we're getting ready to put all of our resources up for the global community as well. We're SMS-based, so it's a little different. It seems like a lot of the components of your program are standalone. But I'm wondering, like your reminders and things like that that might have an SMS component, have you had any experience yet with handing your technology over to another country and how you deal with Rapid SMS, as I believe it is the platform for delivering the content. However, if you need that third party to deliver the SMS, how are you advising other countries to deal with that? Is that kind of something that they handle on their own, or do you have any sort of advocacy or information that you put together, or is it just a recommendation to identify good public-private partnerships?
So when you, just a clarification, when you say third party, what exactly do you mean?
Well, someone to negotiate like your SMS fees.
Okay, yes. Actually, this is an area this is one of our biggest challenge areas. The technology part, I mean, you could use, we often use Rapid SMS, which is a framework for building SMS applications. But you could use a number of other sort of systems or platforms out there. The technology is really the smallest part of the equation, and it's, I think we have that figured out as a community. I think the hardest part is obviously the partnerships that need to happen, and certain things like if you're delivering a mobile health program in a very remote area and you want to absorb the cost, or the government wants to absorb the cost of the transactions over SMS, you need to set up a toll-free number or reverse billing SIM code. And doing that actually seems very easy, but it's actually very difficult because you have to do it across all providers. Providers in most countries are there to exclusively they're so new in these countries, and they're exclusively to make money, which is fine, but they don't have a lot of time to deal with these kinds of issues, or they don't have a lot of expertise. And within the Ministry of Health or within UNICEF, there's also not a lot of technical expertise. So one of the things my team does is help our country offices and governments try to negotiate those kinds of deals. I mean, ultimately, it's the government that needs to negotiate those kinds of deals, and it's really, in the long term, they have to figure out, are they going to give the operators a tax break for providing, you know, very subsidized or free sort of services using their pipes. And that's not something that UNICEF is necessarily involved in. However, that's going to take a while. And in the meantime, what do we do? So in some countries, we'll use a third-party aggregator. In other countries, there aren't any, and so we have to do the negotiations ourselves or support the government to do those negotiations. And it takes a long time, and it's very complicated. It's actually not that complicated, but it becomes very complicated. And actually, we just put out a request for expression of interest globally, trying to figure out who does what where in terms of third-party aggregation, because we would like, you know, our contracting processes are long, governments are as well, you know, any big organizations are. So if we can set up long-term agreements with third-party providers that go across maybe not all countries, but like 3 or 4 countries, we can significantly lower the bar to entry for our country offices and for governments. But it's a headache. Like, if I had known about this, I probably never would have gotten to this space. I don't know if that answers your question.
Alice, I see you shaking your head. Did you want to add anything to that?
Well, no, I mean, I just think your point, Erica, about, once you can get one, whether it's a number or a standard or whatever it is, you can just really scale out much faster and not have to deal with this very specific and intricate questions that I'm sure you get. And in terms of the SMS, would you like to say anything about this, Matthew, or?
I guess so. I guess Intel is working a couple of projects that do involve SMS in kind of the India-Bangladesh region with the Intel Grameen Foundation, where it kind of involves a doctor at a clinic and mobile health workers with feature phones being able to schedule appointments and things of that flavor. So I certainly can put you in touch to see how they're dealing with that in India and Bangladesh specifically. With the school healthcare platform at the moment, we're not utilizing SMS. However, we certainly could build an SMS gateway. We have a server side currently that's based on Drupal, and there's a Drupal module for, I think it's Click SMS, or there's a very easy way to automatically do it. But I haven't. With the school platform, it's more a store and forward where you have you're using a hub and spoke architecture so that you don't have to worry about the connectivity costs associated with lots of SMS. You have hubs where people can, essentially gas station analogy, people can synchronize their content and then work offline, so it becomes much more scalable.
Are there other questions? Yes.
I did have a question. Let me lower this. I'm very short.
Sure.
So my name is Lee Kim. I'm from Tucker-Ernsburg, and I had more of a policy question. That was in terms of the U.S. companies are interested in and seeking to export their healthcare technologies to third world countries, but are there some interesting, valuable lessons learned in terms of the technology implementation of mobile health technology in third world countries that can help to improve the healthcare system here, whether it's mobile health or healthcare delivery?
I don't know, Alice or Chuck, do you have something you want to respond to?
Yeah, sure. We've seen that so far within Continua, where there are some models where we're seeing delivery mechanisms being, carried out in some of the third world developing nations, where the tool sets themselves are, they have the ability, because they're not regulated, they're not at the same level of policy decisions that actually impede perhaps some of the deployments, but they can try some things that we just simply can't here. And it's not saying any dispersions about the U.S. system. We certainly have what we have here in place for a very good reason, but it allows them to experiment with some things to see how they actually deploy and how they roll out. And we've seen some significant outcomes in some cases with, for example, child and maternal health activities in Africa, and seeing how these programs are, using just a small set of equipment can actually help an entire community with these remote aspects and remote access. How that could play in the U.S., necessarily may not be in the urban centers, but we certainly have significant portions of the U.S. where there are very highly dispersed populations. I mean, I live in Texas, and we have 27 counties in the state that have no doctors. So we're very much so in a similar type of an aspect there, and in some cases it's 2 hours to get to a physician. So we have these deployment mechanisms are relatively easy to actually bring into these types of systems as well, because they're very analogous in some cases. But we have begun to see that there are some unique solutions that are being tested in these third world areas that are applicable to our healthcare needs here.
If I may say something to that, I spent 3 years with the Inter-American Development Bank here in Washington. And the multilateral development banks, which I mentioned at the top of my presentation, World Bank, et cetera, do quite a bit of that more state-of-the-art or looking to set up pilot projects of something that may have not been attempted before in these rural areas. And they'll put monies behind it in grants and offer it to these governments to test them out. They also, these multilateral development banks, look for U.S. companies that are looking to participate in these grants. So it's a great way to participate, let them learn about what you're doing, and then getting perhaps some future markets out of it by financing certain ones. Once it's successful in one area, they'll spread it to the sub-region, and then they'll kind of hopscotch across to the other development banks.
I think mobile technologies is truly the equalizer of global health because, as Chuck pointed out, the lessons learned are applicable in developed countries, rural areas, no matter where they are. And where the expertise resides, I think people are willing to make that available and to share best practices and good experiences. So global health is good business. It enhances access to health. It strengthens healthcare systems worldwide. It's going to revolutionize access to care. Are there any other questions? We are about 5 minutes before the networking receptions begin, so I appreciate so many of you staying to the end. I also want to mention that the USAID program provides up to $300,000 for governments that wish to work on standards and uses best practices and helps you design appropriate programs based on your own health needs. So the information is here up front on both the USAID program and also the Department of Commerce Advocacy Center programs. Thank you all for attending. Thank you most of all to our speakers who were also wonderful, and to our technology staff that made this session's technology run so much more smoothly.